Okay, so this is 12:3, and so let's get started. So hello, everyone. So welcome to the Environmental Statistics Week. And this event is sponsored by the Michigan Life Stage Environmental Exposures and Disease Center, also known as M-LEEaD. So today I am very honored to introduce today's speaker, Dr. Francesca Dominici. So Dr. Dominici is the Clarence James Gamble Professor of Biostatistics, Population and Data Science at the Harvard T.H. Chan School of Public Health, and the co-director of the Harvard Data Science Initiative at the Harvard University. So she was appointed Associate Dean of Information Technology in 2011 and Senior Associate Dean for Research in 2013. Dr. Dominici is an elected member of the National Academy of Medicine and of the International Society of Mathematical Statistics. He's an expert in causal inference, machine learning, and Bayesian statistics. She leads an interdisciplinary group of scientists with the ultimate goal of addressing important questions in environmental health science, climate change, and biomedical science. Her productivity and contributions to the field have been remarkable. Dr. Dominici has provided the scientific community and policymakers with robust evidence on the adverse health effects of air pollution, noise pollution, and climate change. Her studies have directly and routinely impacted air quality policy. She has published more than 220 peer-reviewed publications and was recognized in Thomson Reuters 2019 list of the most highly cited researchers, ranking in the top 1% of cited scientists in her field. Her work has been covered by New York Times, Los Angeles Times, BBC, The Guardian, CNN, and NPR. So in April 2020, she was awarded the Carl E. Peace Award for outstanding statistical contributions for the betterment of society by the American Statistical Association. Dr. Dominici is an advocate for the career advancement of women faculty. Her work on the Johns Hopkins University Committee on the Status of Women earned her the Campus Diversity Recognition Award in 2009. At the T.H. Chan School of Public Health, she has led the Committee for the Advancement of Women Faculty. So Dr. Dominici will give an interesting topic on data science and environmental policy. So please join me on welcoming Dr. Dominici. Can you unmute first?
Yes. Okay. Can you hear me now?
Yeah, we can hear you. And
Yeah.
Can you make
Yes.
presentation?
Yes. It's amazing. Like by this time we should have all figured it out, but we still get confused about muting and unmuting button. Anyway, thank you very much for inviting me. It's really a pleasure to speak to you on this very special week on Environmental Science Week. So I would provide a little bit of an overview of the research that I've been conducting with my colleagues and in my lab, mostly during the last year, as you know, everybody's life has changed in the context of the COVID-19 pandemic and the climate change emergency. So I think in the next 35 minutes, I will be providing an overview and try to address the following research question. Are ambient level of air pollution even below the national ambient air quality standards safe to human health? The air is cleaner today, but are we addressing environmental injustice? Does long-term exposure to air pollution increases COVID-19 mortality rate? And what are the key unresolved data science challenges, and specifically challenges in the context of causal inference and causal machine learning and artificial intelligence. So I always like to start with, I believe, is a success story, thanks to the Clean Air Act, and thanks to the Clean Air Act, that is law that mandates the Environmental Protection Agency to review the empirical evidence about whether or not ambient level of air pollution affecting human health. This has been, I consider it a very inspiring and successful scientific paradigm where we collect the data, we do data science, we provide evidence. And if indeed we see an harmful effect of air pollution that leads to policy change, which is lowering the national ambient air quality standard, and that leads to cleaner air. Indeed, as you can see from this plot, all of the ambient concentration of the major primary pollutant in the air have been declining over time, and we have cleaner skyline. Now, one of the scientific questions I've been really interested is, which it's really timely at this time, is whether or not if we look at population that are exposed at a level of fine particulate matter below the national ambient air quality standard, do we still see an increase in mortality risk? And again, this is so policy relevant because if indeed we found evidence that even breathing PM2.5 at level below the standard is harmful, then thanks to the Clean Air Act, there is a strong incentive and requirement to lower the national ambient air quality standard. And also, I'm very interested to identify whether some population are higher risk than others. I've been leading a large group of investigators, actually also data scientists, where I always consider that as a very high priority to assemble large and comprehensive data platform to estimate health impact of environmental contaminant. We have assembled a cohort of Medicare participants. It's over 67 million people. They are now individually followed over time from 2000 to 2016. We actually have just completed to update the database up to 2017. We have all-cause mortality and cause-specific hospitalization. We have the date of death, age of entry, year of entry, sex, race, and whether also eligible for Medicaid, which is a proxy for socioeconomic status. And then we augment the database by the zip code of residence and other covariates. So there is, I think, to do, like I will call it modern data science in environmental health. I feel this is a paramount to invest time and resources into the harmonizing and integrating heterogeneous sources of data. So we literally gather every conceivable potentially relevant data source for the government on health, environment, and socioeconomic status, and we linked a spatial and temporal solution and harmonize. So our research data platform now include estimated exposure to fine particulate matter, ozone, and NO2. And I'm going to tell you a little bit more about this exposure assessment. We also get information from fracking wells, from traffic, from weather, and also now we are augmenting the research data platform with exposure to climate change related exposures like wildfires and tropical cyclones. We link this environmental exposure to health outcome, and I mentioned Medicare and Medicaid claims, and then we also augment the research platform with other data sources, which include potential confounders, both at individual level and also at zip code and a county level. So I wanted to just spend a few minutes to talk about machine learning for exposure assessment. This map shows how we are monitoring the fine particulate matter in the United States, and you see the air pollution monitors of the Environmental Protection Agency are pretty spread up around the country. Still, there are geographical regions in the U.S. that are unmonitored. So through the leadership of my colleague, Joel Jours, but also I should mention there are several teams in the United States and around the world that are doing similar work. The idea is to gather information from satellite data, which provide an imprecise measure of PM. They provide measures of aerosol optical depth. We get weather data, we get land use data, we get output of atmospheric chemistry model. And then we train the machine, which is a deep neural network. And then as a result, so we can estimate at pretty high level of resolution daily levels of fine particulate matter at 1 kilometer to 1 kilometer grade. And so be able to provide exposure assessment to PM 2.5 also in less monitored areas. I think this is a very prominent area of research. I also want to mention my colleague, Professor Marianti, and I call her Professor Marianti because her last name is so hard to pronounce. She is a faculty member at Melman for Columbia School of Public Health, and she's leading an extremely exciting research area on really doing ensemble learning by taking different models that predict PM 2.5, and again, being able to combine both machine learning model, atmospheric chemistry model to really provide the best possible exposure to PM 2.5. So we get daily levels of fine particulate matter 1 kilometer to 1 kilometer grade. And back now a few years ago, we published this very, very visible paper where for the first time we linked for all of the continental United States ambient level to fine particulate matter with the whole Medicare cohort. This was a gigantic study. So the number of participants was 60 million. We have 460 million person years as we have repeated measures over time. And it was really important for us to assess whether or not we see how a mortality risk associated with increase in fine particulate matter, a level below 12 microgram per cubic meter. So a level below the national ambient air quality standards. What we found is that this horizontal line is placed at the national average estimate of the hazard ratio for that for 10 units increase in fine particulate matter. So we found that for 10 units increase in particulate matter, we see a 7.3% increase in all-cause mortality. And what was really striking that for the Black American, we see that the mortality risk associated with an increase in fine particulate matter was 3 times higher than the national average. We also find increases among the Hispanic and Asian, and also a little bit higher increase for people that were also eligible for Medicaid, which is a proxy for low socioeconomic status. Back in 2017, and so pre-pandemic and during the Trump administration, this study attracted an enormous amount of press attention because basically was really the most comprehensive study today to show the levels, even at levels below the national ambient air quality standard, were harmful to human health. And at the same time, also providing for the first time a strong evidence of the fact that Afro-Americans were more vulnerable to fine particulate matter. It was highly discussed and presented in multiple occasions by Senator Cory Booker. And, that actually inspire us to really look even more deeper into the concept of environmental justice and environmental disparity, as I'm going to tell you later. So one of the criticisms during the Trump administration of our Medicare study published in New England Journal of Medicine was the fact that we analyzed the data using standard statistical approaches. And so just using standard Cox proportional hazard model. And we were criticized that as a result of using regression model, we were less able to assess causality. And so, for people that are in this field, there has been a long debate of what does it mean to assess causality. The Environmental Protection Agency, which I endorse, think that by assessing causality, we need to integrate evidence. So you can assess causality by saying whether or not the relationship between environmental contaminant and health outcome is consistent when you review the evidence from many, many, many different studies, which I completely agree. The alternative way is to consider methods for causal inference, which there have been now, which are very popular, and there is an enormous amount of peer-reviewed literature on that. And so in this paper in Science Advance that was co-led by former PhD student of mine, and Zhao Hu and Danielle Brown, who is a research scientist in the team, we reanalyzed the study that we did originally and published in New England Journal of Medicine by using both existing and newly developed methods for causal inference. So we had a similar cohort, just so that we updated the information up to 2016. We have 31,000 zip code. And so we actually have even more information as we basically have a total person years of 573 million. So this is basically the data we now have, as I said, PM2.5 at 1 kilometer grid. We have the 7 individual level and other level confounders, and health data from the Medicare. So the map on the left actually shows how the level of fine particulate matter in 2000 comparing to 2016, of how actually the level of fine particulate matter have been declining over time. So we reanalyzed this data using 5 different statistical approaches. We used the standard Cox proportional approach, which was the same as the one that we applied in the New England Journal of Medicine, that we approximate the Cox model with a Poisson regression, which is much more computationally scalable. And then we used 3 methods for causal inference. One, a new method that we developed that is based on exact matching when your exposure treatment is continuous, and then using standard inverse probability weighting approach in the context of generalized propensity score. And then we also use a generalized propensity score as a covariate into the model. One thing that's really nice about methods for causal inference in the analysis of observational data, that we can visually assess whether or not after we have matched, we have eliminated or reduced the correlation between any potential confounder and the exposure. So this figure on the left shows the raw correlation between each of the potential confounders and PM2.5. And so you see that for some of the covariates, this correlation can be pretty high, which is really, a signal that this is an important measure of confounders. And then with the green dots, we recalculate this correlation after we have created a new population, a pseudo population that is matched with respect to an estimated generalized propensity score. And you see that the correlation is much lower, right? So basically indicating that by matching with the generalized propensity score, we are better at approximating a randomized trial. So what do we found after we reanalyze everything with causal inference methodology? So these are the estimates of the odds-odds ratio for the whole cohort. And so this was the original estimate, the Poisson estimates, and then here are the 3 estimates with the causal inference. So you can see they're pretty similar. Maybe under causal inference approaches, we see a little bit more statistical uncertainty. And then this is really the policy relevant figure, because then we re-estimate all of these parameters only for the population that is exposed at level below 12 microgram per cubic meter, right? So remember, if we found strong evidence of a relationship between exposure to PM2.5 at level below the standard and mortality, it's really strong indication that we need to lower the national ambient air quality standard. So we did find that the methods for causal inference provide an estimate that is lower than the one from standard regression. So basically indicating a little bit that the parametric adjustment for confounding here tends to maybe overestimate a little bit. But bottom line is all of these effects are strong, positive, and statistically significant. We have been conducting a lot of methodological research that is really relevant for policymakers, which I'm not going to be able to go into much of details, but there are the preprints available on the web, where the idea is really to do a non-parametric estimation of exposure response function. So for example, this is the estimates of the exposure response function for PM2.5 and all-cause mortality. This is when it's adjusted by the other pollutant, that is when not adjusted by other pollutants, in a way that also have a causal interpretation. And so this is an area of research that we are very, very excited. And so this is really the estimates of this exposure response function in the context of the whole study for PM2.5 and mortality. And you can see that there is really, it's an increasing slope, and really that there is no evidence of what I would call a threshold. And there is a strong evidence of a linear exposure response relationship a level below the national ambient air quality standard, whether you see it on the scale of the mortality rate or whether you see it on the scale in the context of the hazard ratio. This is extremely important because, especially considering the ongoing and current discussion about climate change, and I wanted to emphasize and remind everybody that climate change and air pollution share the same emission sources. So by regulating PM2.5 and lower the national ambient air quality standard for PM2.5, automatically we are targeting the similar sources of the greenhouse gases. So we're going to save life now. In addition, we're going to combat climate change. And indeed, this is a really wonderful news. This is a news that came up a few weeks ago, where the WHO has lowered the national ambient air quality standard for fine particulate matter from 10 microgram per cubic meter to 5 microgram per cubic meter. And I'm happy to say that the EPA is about to examine the health standard for harmful soot. I also wanted to point it out that in the press release of the EPA, which is going to, be a nice transition to my next topic, they did mention, in addition, a number of recent studies have examined the relationship between COVID-19 and air pollutants, including PM and potential health implication. So this is really a victory for me, as we were the first to publish the first study on showing a linkage between exposure to fine particulate matter and COVID-19 mortality. This study was the two co-lead author was, again, my former PhD student Zhao Hu and Rachel Nethery, which is an assistant professor in the Department of Biostatistics. And again, this is why having this national data platform was so important, because we could leverage all the data that we have and quickly link it to COVID-19 mortality. There is a lot of biological and plausibility of why air pollution can increase the severity for COVID-19. One of the reasons is that one of the cause of death for COVID-19 is acute respiratory distress syndrome, and there is already ample evidence that exposure to fine particulate matter increases the risk for acute respiratory distress syndrome. So we published this study back in November 2020. And by the way, the study, all the data and the code is publicly available. Clearly, this study had a major limitation, which unfortunately there's nothing we could do about it, because one of the major limitations that is an ecological regression analysis. As we know, the ecological regression analysis provide the results that cannot be interpreted as individual level association. But that was the only evidence that we could provide, because unfortunately, still now we don't have a national database of individual level COVID-19 data. So we take area level and county level number of deaths and regress against the county level levels of fine particulate matter and many other potential confounders. And we reported that these are the estimates of the mortality rate ratio that measure the percentage increase in COVID-19 mortality associated with the 1 unit increase in historical exposure from particulate matter. And this plot provided estimates for different time period. As one of the challenge of doing research during the pandemic is that unfortunately the number of deaths continue to occur. And so we will repeat the analysis as more deaths were accumulated. Another important study I want to mention, which was last summer, is that we were really interested also looking at the relationship between high level of fine particulate matter that were occurring during the 2020 wildfires in the west part of the United States and COVID-19. And so this is a second work, a study that we published. Also, all of the data and the code is publicly available. And the goal here really was to look at the high level of fine particulate matter that were occurring on wildfire days and see whether they led to an excess increase in COVID-19 cases, and that's up to 1 month later. This was work led by data scientist Xiaodan Zhu, who she's a data scientist at the Environmental Science Research Institute, and Kevin Josie, who is a postdoctoral fellow in my lab. We use all public available data sources, again, harmonized and linked. This is just a snapshot of the data. So for example, for the Los Angeles County, we have the daily level of fine particulate matter. This is during the period March to December 2020. The green bar are the wildfire days. And so you can see that during the wildfires that were estimated by satellite data that we have this very high level of fine particulate matter. The red dots are the daily number of COVID-19 cases, and the blue dots are the daily number of COVID-19 deaths for the same county. And so we have these 3 panels and many other time series data for up to 92 counties in the western part of the United States. We were really interested to estimate and do a counterfactual time series analysis to estimate the level of fine particulate matter that were attributable to the wildfire days. And basically what we did was we took the observed PM2.5 on 2020 that occurred during the wildfire days, and then we compare what would have been the PM2.5 level on the same day, on the same county, if the wildfire would have not occurred. And we estimate that by taking the historical data of PM2.5 for the same county for the previous years. We estimate the relationship between day-to-day changes in PM2.5 and the COVID-19 cases and deaths for separately for all of the 92 counties in the west part of the United States, and more specifically in Oregon, California, and Washington. We found, of course, some heterogeneity of the association. The pooled relationship, though, shows that there is a strong statistically significant relationship between PM2.5 and COVID-19 cases and deaths that could have occurred up to 1 month later. So we found that up to almost 20,000 extra COVID-19 cases and up to 750 extra deaths were occurring as a result of the wildfire smoke. This is something I'm really proud is that with Environmental Science Research Institute, which by the way, they were also behind building the data platform for the COVID-19 data, there is a publicly available data platform where you can actually click on any counties, and by clicking on that county will give you you can visualize the level of fine particulate matter and the high level of fine particulate matter that were occurring during the wildfire days. You can look at the level of PM2.5 during the wildfire days and non-wildfire days and give you automatically an estimate of the excess number of COVID-19 cases and deaths that were attributable to the wildfire days for that county. One thing is really important, again, that is very relevant in the context of this climate change discussion is that through an international collaboration, I was really proud to contribute to this analysis that basically reported, and the goal was to estimate of the total number of COVID-19 deaths, what was the percentage that is attributable to air pollution, specifically to fossil fuel-related emission and to all the anthropogenic emission. We have, for example, that in Europe, 13% of all the COVID-19 deaths are attributable to fossil fuel-related emission, only 2% in Africa, 15% in East Asia, and 14% in North America. One thing I wanted to mention, oops, I switched this slide. Anyway, one point I wanted to make is through the first work that we did in the New England Journal of Medicine, when we looked at the fact that the Black American population had a higher risk of mortality for PM 2.5. And also, as we all know, the underrepresented minority suffered disproportionately for the COVID-19. As a result of some conversation with Senator Cory Booker and his staff, I was very interested in digging a little bit deeper about the context of environmental disparity. So we have a new influential work that's going to appear soon that is really the goal is to visualize in a most compelling way as possible the environmental disparity that are increasing in this country. And so I want to show you, first of all, I want to show you something that you are very familiar and it's very clear. So first of all, the good news, air pollution has decreased drastically from 2000 to 2016. So the map on top is the levels of fine particulate matter in 2000, the one on the bottom in 2016. So we see that there is less orange, so it means the level of fine particulate matter have been declined over time. Now, I want to spend some time walking you through these two maps. And so I'm going to do it very slowly because I want to make sure that everyone could absorb the information and can see it. So first of all, let's focus on the map on your left, okay? This is a map for the year 2010. And I'm only showing zip codes that have an average level of fine particulate matter above 8 micrograms per cubic meter. So these are the more polluted zip codes, okay? So east part of the United States have all of these zip codes that have a level of PM 2.5 above 8, and some area in California, okay, and some few dots here. Then the blue zip codes are the area where the fraction of the Black population compared to the population for that zip code is higher than the average, okay? So this is basically where you see highest ratio of the Black population to the total population. So in the year 2010, we see that among the zip codes that have level above 8 micrograms per cubic meter, approximately half of the country is where the Black population lives, and the rest is where the white population lives, okay? Now, let's look at 2016. Now, in 2016, we observed two important things. Number one, the number of zip codes that have a level of fine particulate matter above 8, it's lower. Well, I told you that because levels of fine particulate matter have been declining over time. So the number of geographical area in 2016 that have level above 8 is smaller, right? So that's good news. But the bad news is that if you look at how in 2016, the zip code that are still above 8 micrograms per cubic meter are predominantly the zip code where the Black population lives. So what this is telling us is that even though on average for the whole nation, the level of fine particulate matter is declining, it's not declining at the same rate for everyone. We are cleaning the air. We are being in compliance with the National Ambient Air Quality Standard, mostly in the area where there is higher percentage of the white population, where in the area where there is higher percentage of the Black population, they are still affected by high level of fine particulate matter. And so we have measured the environmental disparity. And what this plot shows is even though the population living a higher level of fine particulate matter tends to decline over time, the amount of inequality of this ethnic group with respect to high level of fine particulate matter is actually increasing over time. So I'm just want to wrap up to say that there is a tremendous amount of data science and methodological work behind this analysis, because we need to be able to assess causality from observational data. We need to deal with a measure confounding. We need to quantify uncertainty, and we need to deal with reproducibility. So just to give you one example, right? When I say that we are estimating the level of fine particulate matter, so these are the estimated level of fine particulate matter for PM 2.5 in the Boston area. But there is also statistical uncertainty associated with this machine learning model. And so we really need to be able to propagate the uncertainty from the estimated exposure into the health effect analysis. This is just one slide to show the statistical and data science methodological work behind all of this in terms of how we really assess causal impact of environmental regulation. How do we deal with very high dimensional outcome? How we estimate exposure response function, they have a causal interpretation, and how we use machine learning to pinpoint the most vulnerable population. Very importantly is to have reproducible workflow. And I think that is also something that we really spend a lot of time. We have very, very delighted and fortunate that we have also software engineering and data scientists like Nahin that really does the data pipeline, the software development in a way that is fully documented and reproducible. The work I presented is by no means only my work. I have been blessed and fortunate to have been creating a consortium of principal investigators from many institutions that we are working together on several grant proposals. Leila is our program coordinator. And most importantly, we are really have a pipeline of postdoctoral fellow student, master student, and undergraduate. So this is just some photos of some people I'm sure that many of you will recognize that they are collaborator and cheerleader and been inspiring many of the work. So the conclusion are the steps needed to mitigate climate change in the future are substantially the same as those needed to reduce the burden of death and disability to air pollution in the present, which basically we need to cut back on burning fossil fuel and biomass. In the meantime, machine learning and data science allow us to measure exposure and pinpoint susceptibility and vulnerability with a high degree of precision. And methods for causal inference allow us to better disentangle causes from confounder, especially in the context of natural disaster, like the climate change-related disaster. And I wanted to remind the Nobel Prize in Economics for this year given to Guido Imbens and Angris for their development of methods for causal inference. So looking ahead, I think that it's, for me, and being a data scientist, I place a lot of weight in developing new research data platform. I do think it's important to link spatial temporal data meteorology, climate and air pollution, land use, and satellite sensor readings to understand and quantify linkage to health indicator. And it's really important to understand the distribution of effect on disadvantaged population. We are hiring, and so please look on my website. We have several positions: data engineering, software engineering, postdoctoral fellows, and master level statisticians. So if you're interested in what we are doing, please check out. And if you cannot find our job posting, feel free to send me an email. And then I like to finish my talk with a joke on Zoom, which is almost impossible to do, but I'll do it. These are my two dogs. They're two female, Dory and Tilly. And they said, hey, do you think she will find out how much methane we are emitting? I hope not. Thank you very much for your attention. I'm happy to take any questions.
Thank you very much, Dr. Dominici. And so we have our co-host Dr. Lu Wang here, and but anyway, so for the attendee, if you have any question, maybe you can raise your hand, or you can directly enter your question to the Q&A. So while you are thinking about some question, and so one question that I want to ask you, so you show us that using this 8 microgram per cubic meter in 2010 and 2016, and then so this southern area where this proportion of the Black population. So why did you use 8? So do you think 8 is the kind of the theoretical achievable goal that we can make that happen? So to lower the risk of this air pollution. So can you give us some rationale to use the 8 micron per cubic meter?
Yeah, so that's a good question. So first of all, the national ambient air quality standard right now is 12. The WHO has lowered to 5. So we'll see what the US will do, whether they're going to lower from 12 to 10, 12 to 5, or 12 to 8, right? So that's one conversation. The reason why I choose 8 for my visualization, there was not really any specific policy reason. So if, we have done the analysis for a cutoff for 8, 10, and 12, and we found the same results, was really for visualization purposes, because if we would have chosen a cutoff for 12, there are not many zip codes above 12, so we will not be able to visualize it, right? And so I choose 8 because it's still above 8. It's higher than the average of PM 2.5, and allow you to really see how the distribution of zip code changed between 2010 and 2016, and seeing how the PM is really declining in the white areas, but it's not declining at the same rate in the black area. So it was just to choose an average and for visualization, but with the understanding that the main conclusion of the paper, which is the evidence of environmental disparity are increasing over time, is valid for a cutoff 12, 10, and 8.
Thank you. Yeah. So maybe I can ask one more question. So I think so that is very interesting. So you mentioned that this air pollution, Black American population suffering differentially in terms of this, air pollution level as well as COVID-19. So, but do you have any the empirical data to show that? So this air pollution and COVID-19, and then this Black American population, so like a more causal, the way that so they exposed to this high air pollution level, so that causally lead to this higher mortality rate of COVID-19, and so I'm very curious about that.
So there are several line of evidence. Okay, so a first line of evidence is that the black population breeds higher level of fine particulate matter, and by the way, higher level of other contaminants than the rest of the country. The second line of evidence is that when you're looking at the relationship between the same change in fine particulate matter and mortality, the relationship between fine particulate matter and mortality, it's much stronger. The percentage increase in risk is much higher in the Black population than the rest. Then we also know that COVID-19 mortality is associated with exposure to fine particulate matter. So it's long-term exposure to fine particulate matter increase the severity for COVID-19. So when you're trying to put all of this together, what's happening here is that we have the Afro-American, the black population that breeds higher level of fine particulate matter becomes more vulnerable, together with the compounded effect of often having jobs that prevent them from doing social distancing, plus having higher level of diabetes and cardiovascular mortality. It makes a very dangerous combination. And so we have been seeing that the COVID-19 is basically not only as really emphasize and make it clear the structural racial inequality in this country, but also I think it's highlighting the environmental disparity that is happening in this country.
Thank you. So we have a couple of questions from the audience. First one is, thanks for a great talk. So can you comment on how you and your colleagues come up with policy relevant research questions in terms of the type of input you get and from whom? So Cory Booker was one great example.
Yeah, this is a really an excellent question. So I think that the way is to be, so for example, this is why I'm giving a lot of talks, right? I like to provide evidence of what the research I do, and then I learn every time from the question and from the feedback. So I think with Cory Booker was because basically by publishing a paper on air pollution and COVID and publishing the paper on Medicare, their staffer reached out to us, and we spent a lot of time talking to them and understanding what was important to them, right? So if you're publishing research and you're presenting research, I think that's also really important that you are very open-minded for anyone who contacts you, that is both, policy making, advocacy, and really to learn from the different perspective as much as possible, because more you are engaged into an open-minded dialogue with people that are also outside your circle of scientists, more you learn. And I very much, I read a lot, I look at policy briefing. So I really try not only to focus, and I know this is a lot of work, right? But I try not only to focus on statistical methodology, but also to be, to really listen and figure out what's important for policymakers, because ultimately this is how you achieve, the most important health impact.
Thank you. So we have another question. So from Abbas can be. So do you believe that the increase in mask use due to COVID could also have a protective effect on mortality from air pollution? So how could we begin to estimate mask use among the population if we believe we can confound this relationship?
Yeah, it's a very good question. So to my knowledge, we don't have a study out there, but I might be wrong, that try to estimate the relationship between air pollution and COVID, which, by the way, this is a study that could be done, right? So the way to test the hypothesis is that you wanted to look at the relationship between air pollution and COVID in area where there was a higher percentage of people wearing masks in area where we're not, right? And see if there were a difference. So to my knowledge, that hypothesis has not been tested. Now, the scientists have kind of a disagreement of the degree to which masks protect you from fine particulate matter. Also depends on what type of mask, right? Because, for example, masks were highly recommended during the wildfires period. So it's interesting because, and I'm not the expert on this, but it's interesting that by talking to many scientists, some of them said that they will provide some protection. Others that would say that will not, because fine particulate matter is it's so small that actually can penetrate, into their, even the mask, the 995 mask. So I think that's, to the degree to which wearing a mask is a confounder of the relationship. Again, I think that's something that we should explore and potentially look at the data. This is not something that we have looked in our study.
Okay, so we have one more question from Dr. Karina Groneland. So how are these studies showing association between PM and COVID controlling for occupation? So essential workers may not be perfectly predicted by typical SES covariate, but maybe correlate with PM.
Yeah, so that's also a great question. So we do not have, so in the Medicare cohort, we do not have individual level data on occupation. So that's one fact. The second fact is that I'm sorry, but you're talking about the COVID-19 data, okay, not the Medicare. Okay, well, still, unfortunately, this is one of the problems, right? That we don't have individual level data on COVID-19 mortality. And so we don't know what their occupation is. Now, what we did is we adjust for county level rate of occupation, which I admit it's a really raw type of adjustment. And so that's why, I was very transparent and say that was an ecological regression analysis. Now, in some colleagues have done individual level analysis on air pollution and COVID-19, and they have information from electronic medical record. So they might have been able to adjust for occupation a little bit better than we did. To my knowledge, the results at the individual level from electronic medical record have provide evidence that is very consistent to the one that we have done at the ecological regression level.
Oh, so you mean that even there is an attempt to look at individual level air pollution data as well as COVID-19 mortality and okay. And
yeah, some people have done it in a smaller geographical region because they were able to access individual electronic medical record, right? No one has done, there is no national study at individual level, but there are sub-regional study at individual level. And they, for the most part, have provided strong evidence of relationship between PM2.5 and COVID-19 mortality. I don't know the degree to which an electronic medical record occupation is accounted or not. But yeah, that is another potential really important area to explore further.
Yeah, even though it's not easy to have access to this individual level occupation information, so whether or not they are essential workers or not, but I think this is a important question that we need to address to link this air pollution exposure and COVID-19. Yeah, so this is a interesting question. Okay, so this is already 4:54. So thank you very much for your excellent presentation and very inspiring the question as well as this air pollution and policy and climate change, and so I'm pretty sure that the attendants are very excited looking at your presentation. So thank you very much, Dr. Dominici, and then also thank you very much for the attendance. So have a wonderful weekend. Thank you. Bye-bye.
Thank you.
Yes.
Bye-bye.